Hey, welcome. Today we're going to break down one of the most powerful tools in all of medicine. You might be surprised to learn it's not a fancy machine or a high-tech scan. It's the patient history. It's that initial conversation that really forms the foundation for everything else that follows.
So you've got to wonder, right? How does a doctor turn what feels like a simple chat about your health into a pinpoint, sometimes life-saving diagnosis? It seems almost like magic, but it's actually a very specific science, and that's exactly what we're going to unpack.
And the answer to that question is the patient history. But look, this isn't just a casual conversation. It's a highly structured investigation. You can almost think of the doctor as a detective, and this conversation is their #1 tool for gathering all the critical clues about what's going on with you.
Okay, probably the best way to really get a feel for this is to see it in action. So let's follow a case from start to finish. And of course, every investigation has to start with getting to know the person at the center of it all. So let's meet our patient, John Doe. He's 45 years old, and he's a software engineer. Now, these might seem like just basic details, but for a doctor, they're the first pieces of the puzzle. Just knowing his age, 45, immediately gets the doctor thinking about certain health risks that are more common in that demographic.
All right, now that we have a face and a name, the investigation really begins. And the first place a doctor looks for clues isn't in the present, but in the past. A patient's medical history is an absolute treasure trove of information, if you know what you're looking for.
And this search is incredibly systematic. It focuses on 4 key areas: any past medical issues, the health of close family members, current medications, and of course, any allergies. Each of these gives the doctor another layer of crucial context. So let's see what we find out about John.
First up, John's personal medical file. We quickly learn he has hypertension, that's high blood pressure, and he also has diabetes. Now, these aren't just old facts. They are active, ongoing risk factors that are going to heavily influence how the doctor thinks about whatever problem he's having today.
Then we move on to his family. We find out his father had a heart attack at just 50 years old, and his mother has type 2 diabetes. This is huge. His father's early heart attack is a major red flag, suggesting there might be a genetic risk for heart problems running in the family. The doctor's suspicion level just went way up.
Okay, next up, what medications is he taking? We see he's on metformin for his diabetes and lisinopril for his blood pressure. This tells us his known conditions are being treated, but it's also critical information to have to avoid prescribing something new that could cause a bad interaction.
And finally, allergies. John is allergic to penicillin. It's a simple fact, but it's absolutely vital. Knowing this literally keeps him safe. So think about it. Before we even get to why John is in the office today, we have this incredibly rich context about his overall health.
With all that background firmly established, now we can finally zoom in on the main event, the reason John made the appointment in the first place. In medical terms, this is the presenting complaint, and this is where the patient's own story becomes the most important thing.
John explains, "It's a pressure-like sensation in my chest." Letting the patient describe it in their own words is so important. And that specific phrase, pressure-like, is a classic description that immediately makes a doctor's mind start sorting through a list of possible causes, with a few rising right to the top.
But just that one sentence isn't nearly enough. The doctor has to dissect the symptom. Okay, when did it start? 2 weeks ago. On a scale of 1 to 10, how bad is it? Moderate to severe. What makes it worse? Moving around, any kind of exertion. What makes it better? Sitting down and resting. See how that works? A subjective feeling is systematically turned into objective data. And the fact that it gets worse with exertion and better with rest, that is another massive clue pointing right at the heart.
So now we have all the pieces on the table. We've got John's personal details, all those clues from his personal and family past, and a very detailed story about his symptom right now. The last step is to put it all together and, well, solve the puzzle.
And right here, this is the real magic of the patient history. It's the structure of it all. This systematic approach is what takes a patient's story, which can feel messy and full of scattered details, and transforms it into a clear, logical path that leads straight to a diagnosis.
In fact, doctors literally follow a blueprint. Here's a super common template. And look, you can see every single element we just talked about. Demographics, the chief complaint, past and family history. It's all there. It's like a checklist that makes sure not a single clue gets missed.
And here's another example. You'll notice the labels might be a little different, presenting complaint instead of chief complaint, but the fundamental structure, the core idea, is exactly the same. The goal is always to gather information in a consistent, organized way so you can see the whole picture clearly.
Which kind of leaves you with this one last thought to chew on.
We always think of modern medicine as being about high-tech scans, labs, and complicated procedures. But what if the most powerful, the most fundamental tool a doctor has is just the ability to listen to and truly understand a well-told story?